So let's start with this issue of oversimplification. So a typical example of oversimplification is where we tend to use, for instance, cartoons, okay, without understanding without being mindful of the mindset of our people, or the context within which our people come. Our people see cartoons as toys or for children. So if we oversimplify a health concept by using animation, we may end up getting the wrong issues to come out across, and the seriousness with which we want to attach to the message may end up being diluted, because in our people's mindset, animation or cartoons is toys, is for children. So if there's a serious issue that you want to talk about, you will have to veer away from using the concept of animation. Okay. So that you rather use a film or a video, proper video, or a feature or a documentary. And I'm sure you doing a documentary rather presents a more serious aspect of the story. When it comes to Jehovah's Witnesses, yes, in the advanced world where everybody's rights is recognized, they are pushing all the alternatives when it comes to the use of medical technologies, especially for blood replacement. Truth be told, when you lose a massive amount of blood, the best thing immediately, in order to keep you alive, is to give you blood. So the first thing that we would do is to try to replace the volume. You know, it's the body circulation system is a closed unit. So it's like a balloon. When you lose, say, 50% of your blood, at that point in time, it's like the circulatory system is collapsing. So the first thing that must be done is to put drip or IV fluids to increase the volume, to try to make up the volume. But the reality is that because IV fluids are actually water, they will get passed out. So the person will urinate it out. And by urinating it out, the volume will reduce again. So in as much as you would want to replace the fluid volume, it becomes difficult because the person will keep passing out the fluid. So the ultimate thing is to get blood to refill. In other jurisdictions where there's a lot of research and there's good medical technology, like the US, they will replace with colloids. There are certain things we call colloids. There are special chemicals that will help hold the blood volume, and then you won't pass it. They are like gel. So once you put it in the blood volume, it helps to keep the blood circulatory system running, and you won't pass that liquid out. We don't have all those things in Ghana. So the easiest thing then to do is to give blood to replace blood. So yes, we wish we could, in our country, we wish we could have all these things there, but unfortunately we don't. And in a lot of situations, yes, we try, as health professionals, we try to provide some of these things, but they are not readily available. And so that's why sometimes then the professionals are just forced to give blood to people. Everybody has their reason why they want things done. And Jehovah's Witnesses' views and their rights should be respected. Okay. So yes. But unfortunately, in our setting, we don't always have the needed tools or the needed things to help Jehovah's Witnesses. That's why we tend to have some of the challenges we have. Sensitivity in language, yes. Sensitivity in language in terms of, using words like exposure and all that. Yes, it is. You are absolutely right. You're absolutely right. There's a lot of work being done to promote the right language for sensitive diseases. So I think I will share some of that information with you. I think Martin, I've shared some information. There's a glossary, there's a document on HIV language, emerging HIV language, and even emerging TB language. These days, people are taking time to write documents on the language that should be used for diseases. So yes, I will look for some of that information and share it with you all. And of course, when it comes to the issue of sharing the information quickly enough, where our people are delaying you, then the concept, I mean, like I mentioned earlier, then the importance of building a rapport with them becomes very, very necessary. It is sad that sometimes you would send questions to our colleagues and they will not respond, and yet they will go and sit on air and be talking to somebody else, disrespecting your views or you reaching out to them. Let me apologize for that, but I would suggest I would suggest that yes, let's try to build rapport, especially those of us in health reporting. I know there are few journalists in health reporting. I've dealt with some of them. Immediately they send me questions, even if I'm asleep, even if I have a tight weekend, I will do well to respond to them. The one lady I have worked with is it Rosemary Adefu, yes, from Times, old journalist. Pardon? Daily Graphic. Yeah, yeah. And then no, there's this other lady. Is it Rosemary in Times? And she used to be at Times. Maybe she used to be at Times. I've been dealt with her in a long time, but I used to do stories with her when I was with the government, and I used to work in TB control. I mean, no matter what, I would always, even if I'm asleep and she calls me, I will listen to her. We'll have a discussion. I've had to deal with Audrey Dekalu and a few other people. Yes, so yes, I mean there are a few of the journalists that we've dealt with. It's all about building a rapport with the people, and definitely once you send out your information, especially build a rapport when there's no trouble. And then in the day of trouble, when you send out your request, they would easily want to respond to you. Is that okay? You're right. Let's go on. Well, misinformation and disinformation, yes. How many minutes do I have, please? How many more minutes?
30.
Okay. All right. Let's do this. All right. So misinformation and disinformation. So for instance, the concept of misinformation. If somebody sent you, sometimes somebody sends something on social media, you read it, it's so tingling to your ears, then you also forward it to everybody. You think you are sharing good information, but for all you know, what you are sharing is wrong information. That act is misinformation. But the person who designed it in order to be able to genuinely in order to willfully misinform people and mislead people is doing disinformation. So that is the difference. When it is deliberately done to deceive, that is disinformation. But when when one does it without knowing the consequences, that is no misinformation. So truthfully, there's a thin line between misinformation and disinformation. And it is always important that as journalists who have command of communication and information sharing, to always verify our sources and verify the information before we share it. I know with COVID, people have become so wary even of authentic news sources. all this WHO and CDC and Africa CDC and the health service websites, we are all afraid that they are not telling us the truth. But in health, like I said, a lot of times we want to verify the information before we share it. So we might not be in a hurry to share the information like the way journalists would expect, so that they can break the news. So please bear with us. You may get the information and want to break the news fast, but we will get the information, want to verify it before we announce it. So kindly bear with us, just work with us, and then everything will go well. It is always important that we use trusted sources for information, and then also to critically think through the information we want to share before we share, okay? A lot of times, if you are not careful, you may end up becoming an agent of misinformation or disinformation if you do not verify your sources. Timely and transparent communication is very, of course, is for the journalist, timely and transparent communication is very important. You want to be proactive, okay? You want to be transparent, and you want to be able to provide regular updates. And I know that sometimes my people will feel pressured or will feel bugged by you when you're asking any update. But the reality is that, for instance, when there's a disease outbreak happening, the health system needs to provide regular updates. And so it's a fair balance between the journalists who have to communicate the information and then the health system that needs to provide the information to the journalists. So let's kindly learn to work with the health workers. That's where building a rapport and having frequent communication with them really helps. Okay. We need to engage experts. Like I said earlier, it is not everybody who is allowed to speak on health issues in the health system in Ghana. You need to build rapport with the directors and the bosses. It is only a director who is really allowed to speak on health issues, public health issues that affects the community. So as much as possible, even if the director is not wanting to talk to you, be wary of talking to the small people on the ground. They may give you a certain aspect of the information you need, but the official information must come from the director or whoever is in charge of the geographic area, so that you can say that you verified the information and you can hold the director responsible in case something happens later or certain aspect of the information is found not to be correct. It's also important to communicate with community leaders, okay? Use influencers who are accurate, and then also fact check the information before it is communicated. We all these days are using different multimedia communication tools. So, of course, infographics, animations, videos, documentaries, whatever it is, we all know what to do and how to use them. So let's be sensitive and appropriately use these tools. I want us to now look at the concept of health advocacy and social mobilization, to compare them. These are very, very important in doing health communication. So health advocacy is defined as strategic efforts aimed at influencing public policy, resource allocation, and societal attitudes to improve health outcomes and to promote and to protect public health. Okay, so health advocacy involves lobbying, educating policymakers, raising public awareness, building coalitions to support changes in legislation, regulations, and health practices. Health advocacy focuses on influencing decision makers, such as policymakers, government officials, parliamentarians, leaders in healthcare institutions, to bring about a systematic change. Okay. And usually the changes in policy reform, laws, regulations, and what have you. Health advocates work to ensure that individuals and communities have access to the information, resources, and services they need to achieve optimal health. It is usually a top-down approach. So you start with the leaders at the top to make the information sharing, or you do the right thing up there. And then it comes down. It also is evidence-based, and it tends to be long-term change. It seeks to achieve long-term change. The key activities in health advocacy include policy advocacy, okay, where you're lobbying for policy changes, drafting of legislation, and engaging policymakers to influence public health policies, okay. Public awareness campaigns and coalition building. It's interesting that in Ghana, we are not getting a lot of health advocacy being done. So for instance, one of the big issues that we all know currently that I believe that we should be doing a lot of health advocacy on is the issue of galamsey. We need to fight. Other than that, our country will be in jeopardy very, very soon. Okay, very, 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 very soon. It's so sad that we have allowed this whole concept of unbridled mining to destroy our environment. We need to make a lot of health advocacy at the policymakers, the decision makers, target them to change, to make sure that there's a change in policy and change in the way things are. And once we get that done, the outcomes will be complete policy change, increase awareness creation, and then long-term impact. So, for instance, I'm sure a lot of us know that there's mining even in the US. And the mining, it is regulated mining. There are small-scale miners, there are large-scale miners. There's gold mining that goes on, but it is all properly regulated. They don't destroy the environment. They don't destroy the water bodies. That is what we should be doing in Ghana, where we can. We would work, we would promote proper health advocacy for our leaders to take the decision. Unfortunately, in Ghana, it looks like even the leadership are involved in causing all the havoc. So it's up to us. We all need to be part of the fight against unbridled and uncontrolled small-scale mining, which is literally destroying our country. The other side of the coin is social mobilization. Social mobilization is is the opposite of health advocacy. So social mobilization is the process of engaging and empowering communities to take up collective action towards achieving a common goal, particularly in public health. Okay. And the focus is to harness the collective power of the community, as against health advocacy, where we are harnessing the power of the decision makers. Okay. So social mobilization rather looks at improving health outcomes from community and driving behavioral change at the community level. It relies on building trust, fostering collaboration, and using culturally relevant approaches. It's a bottom-up approach. There's community engagement, and there's immediate action that is needed to do that. The key activities are community outreach, behavior change campaigns, capacity building, And the target is the community, where we use the people themselves, and then we also use local leaders to do the social mobilization. The outcomes are community empowerment, behavioral change, and immediate and tangible outcome results. So we can do both health advocacy at the top, and we can do social mobilization at the community level, all in a bid to drive outcomes, positive health outcomes for us. At the end of the day, usually we see that health advocacy, the challenges are political resistance. So like we are seeing in Ghana with the Galamsey issue, we are seeing a lot of political resistance. Okay, the politicians, instead of supporting it, they are rather resisting it. Okay, it becomes more resource intensive, there are long time frames, but it is still doable. So, comparatively, social mobilization requires a lot of sustained engagement at community level. There are resource limitations. How much can you do moving around communities to try to bring about change in their mindset? And then cultural barriers. So where, for instance, poverty has become so rife and so endemic that people are willing to die seeking money rather than changing the world or maintaining a good environment for their children. These are some of the challenges that we have to grapple with. Most importantly, these two approaches are complementary. They interconnect with each other, and then they all require an integrated approach. We can use both approaches to still achieve whatever we want to achieve. Any questions? And then we'll dive into the last aspect of this session, which talks about the emerging pandemic-prone infections or emerging pandemic-prone diseases. Okay. Any question?
Yeah. Yes, Doc. Just a minute.
Okay.